at the top of the surface you add a hex, and the connection used to the abutment used to come and see. This connection was not very secure. Easily. Okay? So it was getting loose very easily. Right? So they decided some other designs also. You have something known as a Mickey Mouse connection also. If you see this, on the right side, unfortunately we'll have a pointer working pretty soon. On the right side, do you see a Mickey Mouse kind of a design? 2 ears and a chin. This is known as a Mickey Mouse connection. Right? Popular with which implant system? Noble earlier used to have a Mickey Mouse design. Now every company wanted to make their own implant. Every company wanted to have an implant which had their own USP. So every company told no, mine is better, mine is better, mine is better. So they wanted to be slightly different. So they went ahead with a Mickey Mouse connection. Now that was also a problem. Now if I want the connection B to be more secure, what happens is I want to move it more deeper. The more deeper the connection is, will it not be more secure? If it is more superficial, the chances of loosening are much higher. If it is more deeper into the implant, what will happen is it will be much more secure. So another company known as Dentsply started with an implant system known as Ankylos. Okay? Ankylos implant, it used the phenomena known as cold welding. ये स्क्रू वगैरह का चक्कर बहुत खराब है, स्क्रू है तो लूजन होगा ही होगा. Let us go ahead with the phenomena of cold welding. Now any one of you can explain me what is cold welding. You must have heard this word before. Cold weld हो गया, कल भी शायद someone used it, right? For something they used it and it will get cold welded. What is cold welding? Okay, what is welding? Ortho people, prosto people, dental graduates, man, basic. How? If I talk about normal welding, what do we require? Heat. Can I heat and join them there? No, not possible. Because I want a possibility to be able to remove them later on. Right? And I cannot do that in the patient's mouth. Right? So what do? I use a phenomenon known as cold welding. Now what is cold welding? Any one of you can explain me what is cold welding? Glass in a glass concept. Have you gone to marriages and functions where there are steel glasses kept? Right? They are stacked together. Now if you press them together, what happens? One glass gets fixed into the other glass, right? Is there any glue between them? No. Then how does it get packed together? Friction fit. They are so close to each other that they are made in such a way that they will fit into each other. This phenomenon is known as cold welding. So there is no actual welding. Actually there are two separate parts, but they have become so fixed to each other, they look like one part. Right? Have you seen that phenomenon with plastic glasses also? But which is more secure? Steel. But the stiffer the material, the better will be the phenomena of cold welding. In implant, do we have a stiff material? Yes, we have titanium to titanium, right? So what did this company say? We will use the phenomena of cold welding. We will make the internal surface of the implant like a cone, and in the similar direction, we will make the abutment also. So now what happens is, when I fix the abutment, it will get cold welded. And what will happen over a period of time? The patient will continue to eat. So it will be basically more forces coming on top of it. So will the cold welding become better or will it become poorer? Better. Glass में glass से ऊपर से और ठोक रहा हूँ मैं उसको. I'm hammering it in. There is a point till which it can go in. It's not that it will keep on going in. Okay, it is not, and it is not actually hammering. It is just optimum forces of occlusion, right? We are not talking about it. It doesn't mean that you make it a Baxter force, right? So it is, yeah, sure.
Whose is this? You got it from where?
From orthogonal.
Right? Perfect. Thank you. Yeah, point also. Thank you. So what did they do? They made this well in what shape? Like a cone. And then they allowed another cone to fit into a cone. So it is a cone in a cone connection. So this concept was known as pole welding. Right? But there was a problem in this connection. What was the problem? Now in an internal hex, in how many positions can I place my abutment? 6. In a cone, how many positions can I place my abutment? Infinite. It was impossible to transfer the abutment in the same position. Once I remove the abutment, there is no way that I will be able to transfer it exactly in the same position. So this was a problem with this connection, right? So then the new age company came with another feature. They told we will take these two together and make another connection. So what did they do? They took a cone, but at the bottom of the cone, they made a hex. Like, they took a cone, but at the right at the bottom, like at this part, they made a hex. So what do we call it? A deep-seated internal hex connection. We can call it a deep-seated internal hex connection, right? Because the internal hex connection from this part has moved to this part, and the area between them is what? It is like a cone. It is not parallel. So we call it a deep-seated internal hex connection. So most of the companies today, when they say that we have a conical connection, they don't have a conical connection. They have a cone and a deep-seated internal hex connection. That is what they have. True conical connection was made only and only by one company, which is Encalos, and presently used only by one company. Even Encalos has changed its design now. It has got some orientation grooves now. It is now used by another company known as Biocon. Short implant where the abutment is hammered in. Okay, thank you. So all this Cover Nedi, what kind of a connection does it have? Deep-seated internal hex. What connection does ostium have? Same. What connection does dentium have? Same. What connection does dentist have? Same. Even the conical connection of Adel now or Norris now is again you have got two connections now. They call it cone fit. It is again a deep-seated internal hex connection. Now just to be different from each other, what they have done is, the degree of taper is different. In ostium it is 10.8 degree, in dentist it is 12 degree, in Encalos it used to be 6 degree. That is all. So when you interchangeably use your components, many people do that. So fit to ho raha hai na? Fit ho raha hai, but the degree of taper might be different. So if you are using that interchangeable fit for a temporary thing, like healing cap काम में ले लिया, चल जाएगा. Impression post काम में ले लिया, चल जाएगा. But final abutment नहीं काम में लेना, right? Because the taper is different, there will be some gap, some minute gap which you might not be able to see with your naked eye. So never ever interchange your abutments between companies. Okay, because there is a difference. No two companies can legally make the same thing. There has to be some difference. So most of the connections that so what is the connection that is presently used in this thing, GMI Frontier implant that you are using? It is a internal hex connection, right? This is the same connection which is used in a company known as Zimmer also, right? Gold standards. That is where we have it for 1 second. Most of the connections, most of the Korean companies' connections are internal connections with a deep-seated internal hex. External connections are only available in a implant which is a transmucosal implant, wherein the multi-unit abutment is attached to the implant itself. Like Straumann has those implants. Okay, wherein what happens is the polished collar is there on the implant, so you place the implant, the polished collar is there, and on top of it you have a external connection. But that is only used for full mouth cases, mostly. Okay. So see, these are words that you will be able to hear many times. Cold welding. जो वाइवा के बाउंसर्स नहीं होते हैं, तो एक्सटर्नल एग्जामिनर पूछ लेता है कभी भी, ये वैसा वाला है. So cold welding is a phenomena wherein a cylinder fits into a cylinder, okay, and the actual taper that is required for cold welding is perfect. Is around the gold standard, which is 6 degrees of Encaros. No other company has been able to mimic that gold standard. They are coming close to it. An implant which was developed by a scientist and an aeronautical engineer. So the aeronautical engineer was the guy who put in all this mechanics into it. Right? Now, one might say that, okay sir, let that connection be the best connection if it is not moving. Why not use only that connection? We will not have to remove the abutment. Let it be not a problem. There is a problem. Imagine if I have a stack of bricks, right? And I put a hammer on top of it. I try to hit it with a hammer. What will happen? The bricks will break, right? Now if I have the same hammer, the same force has to be applied and the bricks are there. But I do not want the bricks to break. What should I do? Put some cushion. Okay, that is one option. But something has to break. I'll keep on hitting it when something breaks. So I put a weaker pattern. Now suppose I put glass on top of it. So when I put the hammer, what will break? The glass will break. So what is the glass doing? It is actually in a way protecting the bricks. Right? So in that assembly, imagine the crown is there, the abutment is there, the implant is there, and the bone is there. And there is a force which is more than the force that is required because of some reason. Something is going to give way, right? Which should be that first thing that is important. If everything is very stiff, very rigid, what will happen is something will break. So either the screw will break, or in certain cases the implant might break, or if I have a zygomatic implant in place, the bone might break. So इन सब से तो बेटर है क्या कि इम्प्लांट अबटमेंट जंक्शन लूज हो जाए. लूज को तो फिर भी टाइट कर सकता हूँ, right? So sometimes too much of perfection is also not good, right? You want it to be secure, but not too secure. Obviously, we try our best that the forces should be optimized, the biomechanics should be perfect. But even if the biomechanics is wrong somewhere, there is some excessive force. What is the easiest thing to correct is screw loosening. This is also another advantage of a cement retained crown. What happens in a cement retained crown is, which is the weakest point? Cement. The cement. So what will happen? The crown will come out. So easy to put it back. Right? So remember, if the crown is coming out again and again, if the screw is loosening again and again, if the abutment is moving again and again, that means there is something wrong with the biomechanics. So it doesn't mean you again keep on doing the same thing, hoping it will become right. If I have to go to Jaipur, if I keep on going towards Bombay, I will never leave Jaipur, even if I try 100 times. Right? So doing the round thing again and again will not make it right. So just re-cementing the crown or just tightening the screw again and again will not make a difference. Right? There is something wrong in the biomechanics part of it. That is why it is not able to withstand the force. Right? So that is what you need to reconsider. So if the patient comes to you with screw loosening, one of the most important instructions that we give our patient is, as soon as the crown starts to move or the process starts to move, please come back. It is very important for you to come back. Because if you allow it to move, what will happen? The screw will fracture. And one of the biggest nightmare that you can have is the screw fracture, especially in a posterior area and especially in maxilla. Because then that implant becomes unusable. Right? You will have to place another implant. And if you don't have a location to place another implant, then you don't have a choice. Right? It is very difficult to remove an osseointegrated implant. Okay. Another term that you will hear a lot is platform switching. You have not come into private practice yet. There are two gimmicks, there are two terms that your people will use a lot when they want to sell you an implant. Sir, हमारे implant में platform switching है, sir हमारे implant में conical connection है, and हमारा implant active है, sir. Right? So we are not talking about the surface anatomy. Prosthetically, these two things are very important. What is platform switching? And I can assure you, you make any implant guy sit and ask him or her what is platform switching that you are trying to sell him. They will not be able to explain. But the unfortunate part is, even we sitting on this side of the table do not know what is platform switching. Someone has told platform switching is good, so it must be good. Now what is platform switching? You see, this here is the abutment, this is the implant. The dark grey part is the abutment and this is the implant. Now here, on the left side, the external surface of the implant and the external surface of the abutment are same, at the same joint, right? Whereas here, what is happening is, I have used a narrower abutment. So what happens, the junction from this point shifts to this point. What happens? Now, despite having a good connection, despite using the proper tools, I will still have some microbes going in, right? Now here, just next to it is the bone, right? Here, the bone is here and the connection is moved differently. So I've shifted the connection from there to there. So what happens, even the microbial pump that is acting, the microbes that are acting are moved away from the bone to implant junction. So what happens is, it leads to lesser amount of bone loss. See this here. In the first case, you have got platform switching, wherein the junction is moved from the bone to implant to a more inner side. Whereas here, you have the junction right there. So in this case, you will have some bone loss. Right? Can you see the bone loss on the right side? The top one thread is exposed. The top 1 mm is exposed. Earlier, it was acceptable to have some marginal bone loss. Now, it is not acceptable. Now, I expect my implant to retain like this, and even in certain cases, for the bone to grow on top of that platform. Now, this is only possible if I use a phenomena known as platform switching. So, to preserve that junction, what I do is, I have moved the microbial platform to a more inner side. That is all what I have done. And how I have done is, by using a abutment which is narrower than the implant. Now, do we have to do anything actively nowadays? No. Companies take care of it. They make an abutment which is narrower. We don't have to do anything. Okay. Now, do you know implants are of different diameters? All of you are aware. Do you know abutments are also of different diameters? So you might say, sir, if I am using a 5 mm implant, I should use a 4 mm abutment for this platform switching to happen, right? Is that the case? No. The diameter of the implant that the company says is the top part, this part, not the bottom part. This bottom part is fixed, regardless of whether it is a 4 mm diameter abutment or a 5 mm diameter abutment or a 6 mm diameter abutment. So this phenomena of platform switching will be there regardless of whatever implant diameter am I using and whatever abutment diameter I am using. This will be regardless. This might become more wider, the platform with a more wider diameter implant, but it will always and always be there. So this phenomena of moving the platform away is known as platform switching. This is a design-based phenomena which is incorporated by the implant company itself, right? This is incorporated in most of the implant companies nowadays, and the reason to incorporate is to reduce the crestal bone loss, right?
Sir, how did this actually happen? इससे bone loss कैसे prevent हो गया?
देखो, ये देखो. Here, the junction is here. This is the abutment and this is the implant. So junction is right at the area where the bone is supposed to attach. Imagine this here. Now the bone was supposed to attach here. Now there are three things joining there. The bone and the implant and the implant and the abutment. Now whenever there is an implant and an abutment joint, there is a pump. There is some microbial leakage. There is some amount of microbes being formed. Regardless of whatever connection I have, even in a conical connection, there is some microbial leakage. Now what will happen because of that microbes coming there? They will form an nidus there and that will lead to bone loss. So what did I do? I cannot stop that microbial platform to be forming. So what do? I move the platform. Now the implant to bone junction will remain here only. What did I do? I moved the abutment to implant junction much more inside. So by doing this, what did I do? I moved the platform from here to there. And therefore now bacteria are still there, but they are now away from the bone. Now imagine if you are in bad company. What does your parents do? लड़का तो ऐसा ही है हमारा, लड़का हमारा तो अच्छा ही है, या लड़की हमारी तो अच्छी ही है, कंपनी खराब है, कंपनी से दूर कर दो, right? So that is the same thing what they are doing here. They are moving it away with the hope that there will be less crestal bone loss, right? And that is what tends to happen. So Encalos earlier, because the connection was so good, they also, and they had a phenomenon of platform switching, they used to claim that we have zero bone loss implant. Right? Because the connection is also very good and they had the phenomena of platform switching. Now, the irony is, this phenomena was discovered just like that. This is not something which was thought about. How did it happen? It was an accidental finding. Okay? People wanted wider implant. Their company started making wider implant. But they never used to make, they were not able to make such wide abutment. So they decided what? Okay, let us use a wide implant, but let us use a smaller abutment. So when they started doing that, they realized this is good. This is what is preserving bone over a period of years. And then they actually thought behind the science behind it. Then they came to know, okay, the platform is getting shifted. That is what is preserving it. And that is how the phenomena of platform switching came into picture. Right? So the implant wherein the platform is not switched, which I don't remember any implant nowadays, is a platform matched implant. Okay? Most of the implants are nowadays platform switched implants. They have that phenomenon incorporated into it, right?
The same thing when we are doing in an anterior case. So, like if as I'm placing an abutment, तो आपका cusp form होता है. If I'm doing a platform stitching in that case, तो वो मतलब abutment और cusp के बीच में distance थोड़ा बढ़ नहीं जाएगा?
नहीं होगा. एक्चुअली में ये जो प्लेटफॉर्म होता है ना, इसके ऊपर वो आ जाता है बोन. Just like your CJ comes into picture, it's the same way like a CJ. तो डिस्टेंस नहीं बढ़ेगा. कफ तो आपके यहाँ पे ही अटैच होगा, इस पार्ट में. आपका see only this part I am shifting, not the top part. Your cuff is getting formed here, right? This and this is same. What I am shifting is only the bottom part. आप इस ग्रे को देखो और इस ग्रे को देखो. सिर्फ जो नीचे वाला पार्ट है ना, ये पॉइंट, ये शिफ्ट हुआ है. ऊपर वाला पॉइंट शिफ्ट नहीं हुआ है, राइट? इसमें ये टॉप पॉइंट A and point B are the same. Point C and point D is where the shift has happened. So your cuff is getting formed here. Soft tissue will form till that point. Even if you use a more narrower abutment, it will form till the abutment. Wherever is the abutment surface, it will not leave a gap. Okay? Soft tissue requires some support. तो आपका abutment कितना भी narrow होगा, अपने आप soft tissue वहां तक form हो ही जाएगा.
What I was saying, would that be applied in case of the one when they're putting healing abutment?
No, in healing abutment you are keeping it for only some time, na? Only for 2 weeks.
But like suppose if a mishap is there, if we are not placing the adequate width of the healing abutment or designated implant, or we are putting a larger healing abutment or a smaller healing abutment to an implant, so what changes?
See, that's what I'm trying to say. A healing abutment has got two parts. Let me go back to the healing abutment. See, this part is not changing. This part is same in 5 mm, 4 mm and 3 mm. Only the top diameter is changing. The top part. और मेरा प्लेटफॉर्म स्विचिंग यहाँ पे हो रही है, इम्प्लांट और अबटमेंट के जंक्शन पे. फिर नीचे वाला पार्ट तो सेम है, यहाँ पे भी और यहाँ पे भी. Now imagine if I put a line on top of it. If I see only the bottom part, all three bottom parts are same. Same thing happens in an abutment also. Okay? And same thing happens in a healing cap also. The bottom part is the same. And the platform switching is because of this phenomena, not the top part. तो अगर आपने abutment का diameter गलत भी select कर लिया है, तो आपने ऊपर का part गलत select करा है, उससे आपका processes affect होगा. अगर आपने healing cap गलत select करा है, तो उससे जो ऊपर की curve बनेगी वो गलत बनेगी. Now what you are trying to say is, suppose in an anterior case you should have ideally used a 4 mm healing cap. उसकी जगह पे you use a 6 mm healing cap. तो बहुत बड़ा बन गया कफ, राइट? अब आपने जब अबटमेंट लगाया तो आपने अबटमेंट तो छोटा लगाया 4 mm का, राइट? तो गैप रह गया. क्या वो गैप रहेगा? पेरियो पीपल क्या होगा? अपने आप सॉफ्ट टिश्यूज को कवर कर लेगा ओवर अ पीरियड ऑफ टाइम. सॉफ्ट टिश्यू कॉन्टूर कैसे होता है? सॉफ्ट टिश्यू में प्रॉपर्टी होती है कि शेप ले लेता है. आपने 5 mm का हीलिंग कैप लगाया था तो उसने 5 mm का डायमीटर का शेप ले लिया. आप 4 mm का हीलिंग कैप लगा देते हो, 4 mm का डायमीटर का शेप ले लेता. आप 3 mm का हीलिंग कैप लगा देते हो, 3 mm का शेप ले लेता.
सर इसी टाइम पे
हाँ,
अगर 4 mm का इम्प्लांट है, 5 mm का कैप लगाया, मैंने निकाला एंड आई हैव टेकन द इंप्रेशन एट दैट पॉइंट. अब लैब में जब वो कंस्ट्रक्ट होने आए, अब 1 वीक लेटर द पेशेंट कम्स, तो फिर उसका डायमीटर चेंज नहीं होगा.
तो वही तो मैं कह रहा हूँ, तो आपने सॉफ्ट टिश्यू प्रोफाइल ही गलत बनाई ना. तो जब कल मैंने इंप्रेशन लिया था तो सॉफ्ट टिश्यू प्रोफाइल गलत रिकॉर्ड करी. आपने सॉफ्ट टिश्यू प्रोफाइल गलत रिकॉर्ड करी तो ऑब्वियसली वो एक्यूरेसी तो नहीं आएगी और वो शेप तो नहीं आएगा. सी हीलिंग कैप का पर्पस क्या होता है? प्रोसेसेस बनाने से पहले शेप करना सॉफ्ट टिश्यू को, आइडियल शेप। अब आप जो कर रहे हो उसमें आपने प्रोसेसेस पहले बना दिया है एंड नाउ यू आर होपिंग कि वो सॉफ्ट टिश्यू उसका शेप ले लेगा, right? So that is why, if you remember, one of the parameters in impression making was soft tissue recording also, right? So आपने पहले गलती कर दी 5 mm का बना के, अब आप होप कर रहे हो कि अब वो उसके कॉन्टूर के हिसाब से कवर अप कर लेगा। कवर अप करेगा, प्रैक्टिकली क्लिनिकली करेगा, बट उतना बढ़िया नहीं करेगा जितना कि प्री फॉर्म्ड होता था, राइट? दैट इज वेयर द डिफरेंस इज। Abhi we will be going to the parts of the abutment. You will be able to understand this phenomena better. See this. This is the ideal situation that you want. Remember, once the bone is stabilized, what makes it in the same place is two things. One is this biological width, the seal, so that the microbes don't come in, and the second is the forces. अगर दोनों कंट्रोल में हैं, तो आपके इम्प्लांट में बोन लॉस नहीं होगा। Periopecies, do we have periopecies? कहाँ है? What is the biological width? What is the value of it?
In a plant, it is 3.08.
Why 3.08 in an implant? Longer bone, okay. Now this complete distance, right from this part till this part, is known as the biological width. Now body will maintain that biological width. अगर आपकी बोन लॉस होगी तो सॉफ्ट टिश्यू उसको हमेशा फॉलो करेगा। अगर आपको सॉफ्ट टिश्यू ग्रो करना है तो आपको बोन भी ऑगमेंट करनी पड़ेगी। Now the better the seal will be, the better it is. Now by making this platform switching, देख रहे हो, see the lighter part, abutment यहाँ पे मूव हो गया, पहले यहाँ पे था, अगर बाहर होता तो platform switching gives a platform for the bone to grow and a platform for the soft tissue to grow, right? So this is what preserves the bone loss. See this here, it is a platform match. मैचिंग है ना अबटमेंट और उसमें, तो यहाँ पे क्या हो रहा है? क्रेस्टल बोन लॉस हो रहा है, यहाँ पे स्विचिंग हो गई, अबटमेंट छोटा हो गया, ठीक है? बट सी सिर्फ ये वाला पार्ट छोटा हुआ, ऊपर वाला पार्ट नॉर्मली है, सेम है। टॉप पार्ट से कंफ्यूज मत होना, नीचे वाले पार्ट है, ठीक है? तो यहाँ पे क्या हुआ? देयर इज लेसर चांसेस ऑफ बोन लॉस, देयरफॉर यू हैव अ फिनोमेना ऑफ प्लेटफॉर्म स्विचिंग इनकॉर्पोरेटेड इनटू इट। Now this is what I was talking to about as internal connection. The first one is a internal leg, the second one is a tripod or a Mickey Mouse connection. The third one is a Morse taper or a true Morse taper connection. And the last one is a deep seated internal hex or a Morse taper with an internal hex. ठीक है? और ceramic crown की margin को क्या कहते हैं? Prostopipil, finish line, shoulder, all ceramic के लिए,
radial shoulder,
radial shoulder, all ceramic के लिए, yes sir. तो rounded shoulder किसमें देते हैं?
radial shoulder is rounded shoulder.
Radial shoulder, rounded shoulder, the same thing.
तो उसके अंदर 90 डिग्री होता है शोल्डर में, रेडियल शोल्डर में 120 डिग्री।
इंटरनल एंगल इज राउंडेड, वो देते हैं ना ऑल सेरामिक में, राइट? So in this also you can call this connection either a deep seated internal hex or you can call it a Morse taper with a internal hex connection. So this is the connection what you have. Now this is an external hex. This, see, there is a taper here. This is known as a Morse taper. Here there is a taper followed by a hex. So this is a internal hex connection. Now this is the three parts that I was telling you about. आज के उसका ये part important है understand करना. You have got three parts to an abutment. First is the processes connecting segment. That is the segment where the processes comes and gets seated. That is the prosthetic connection segment. The second is the implant connection segment, right? The part which goes into the implant. कल shade करके बताया था. And the third part is the transgingival abutment. So this part where the prosthesis fits in is known as the prosthesis connection segment, right? This part which goes into the implant is known as the implant connecting segment. And the third part is known as the transgingival segment. Now, हर एक part की क्या importance है? What is the importance of an implant connection segment? वो joint secure करना, implant और abutment का जो joint है, वो secure करना, वो ensure करना कि वो adequately well fitted हो, there is no microbial leakage, there is no screw loosening. Now this can be a internal hex, a external hex, not external hex, internal hex, a conical connection or a deep seated internal hex, right? So that is the implant connecting segment. So implant connection segment कौन decide करता है? Implant company decide करती है, आप और मैं decide नहीं करते. आप लोग सिर्फ उस implant connection segment टाइप का implant ले सकते हैं. Some people have a preference for an internal hex. They buy a internal hex implant. Some people have a this thing for a conical implant, so they buy a conical implant, right? So depending on that, so this is determined by which the company determines it, right? तो क्या हो गया इसका determination? कंपनी डिटरमाइन करेगी, पहली चीज, ठीक है. दूसरा पैरामीटर, ये किस मटेरियल का बना हुआ होगा? What material is the ideal material to make this segment? Titanium is the ideal material, right? But when you are doing your casting, when you are using your plastic UCLA abutment, what material are you making it as? आप लोगों ने abutment देखे हैं, plastic UCLA abutments वगैरह? Are you aware of it? So then we will move forward and then come back once you understand what is the plastic UCLA abutment. So this part ideally should be made up of titanium. This should be as good fitting into an implant as possible, right? So who will be able to make a better fit? The implant company or you all? The implant company. So ideally this segment should be machined or made by a implant company. This should be of a material known as titanium only, similar material, right? The second part which is there, the transgingival segment. What is the importance of it? This is what gives the emergence profile. जो looks आते हैं, aesthetics आते हैं, वो कौन देता है? वो ये देता है. इसके ऊपर क्या attach होता है? Soft tissue attach होता है, right? इसके ऊपर pink part attach होता है. So this is what gives the soft tissue. तो जो biological width maintain करने का part होता है, जो emergence profile देने का part होता है, वो कौन करता है? वो transgingival segment करता है. ठीक है? So अगर आप इसको perfect चाहिए, तो अगर आप बाद में 4 mm diameter का abutment काम में लेने वाले हो, तो आपको healing cap कितने diameter का लगाना चाहिए? 4 mm का. It should all be same. Because आपने soft tissue को shape 4 mm के हिसाब से करा है, तो abutment भी same होना चाहिए ना, right? So remember that. Now coming to the first part, which is the prosthetic connection segment. ये क्या determine होता है? This is determined by the crown, the anatomy of the crown. क्या इसकी length होगी? कितना interocclusal distance है? कितनी interocclusal space है? इसका क्या angulation होगा? ये सब किसके ऊपर determine होगा कि crown किस position पे लगाना है, right? At what position do you want to place your crown at? What is the angulation of the crown, right? So this should be customizable as much as possible, because every patient will have a different crown, different positioning of crown, different height of crown, right? So this portion should be कस्टमाइजेबल. सो आइडियली इम्प्लांट वाला जो कनेक्शन सेगमेंट है वो कस्टमाइजेबल नहीं होना चाहिए, वो कंपनी फिटेड होना चाहिए. और ये वाला जो पार्ट है कि जितना कस्टमाइज करोगे उतना बेटर है. सो व्हेन यू सिलेक्ट योर अबटमेंट्स, these factors are important, right? Now this is how an ideal abutment looks like, right? ये एक स्ट्रेट अबटमेंट है. इसके अंदर कितने पार्ट्स हैं? नीचे जो पार्ट है which is the silver part, what is that part? That is the implant connection segment. वो किस में जा रहा है? इम्प्लांट के अंदर. तो अगर मैं उसको इम्प्लांट के अंदर डाल दूंगा तो इस क्रोम वाला पार्ट मुझे विजिबल नहीं होगा, राइट? नाउ डू यू सी इसके नीचे क्या बना हुआ है? हेक्स बना हुआ है. और ऊपर क्या है? एक कोन है. सो दिस इज अ डीप सीटेड इंटरनल हेक्स कनेक्शन. दिस इज अ डीप सीटेड, क्योंकि जो इंटरनल हेक्स है वो इम्प्लांट के टॉप पार्ट पे नहीं है. अगर यहीं पर ही हेक्स होता तो एकदम ऊपर ही हो जाता. So that would have been a normal internal hex. Now I've just moved it down. So see your add-in implant abutment and see your cover media abutment. You'll find a difference. Both have a hex, लेकिन hex की positioning अलग है. अगर आप उनका एनालॉग देखोगे तो एनालॉग में भी आपको पोजिशनिंग अलग दिख जाएगी. एड-इन में एनालॉग में वहीं पर ही दिख जाएगा हेक्स, ऊपर ही सुपरफिशियल, right? Whereas in cover media it will be much more deep. So this segment is known as what? The implant connection segment. The most popular type of connection right now is a deep seated internal hex connection. ये जो टेपर है डिग्री का, ये दोनों टेपर्स है ना, this differs from company to company. So two companies abutments might fit in interchangeably, but अंदर एक minor फर्क हो सकता है वॉल्स के बीच में, राइट? ठीक है. नाउ द सेकेंड पार्ट विच इज मार्क्ड एज सी, दैट इज द विच सेगमेंट? द ट्रांस जिंजाइवल सेगमेंट. ये सेगमेंट कहां से कहां तक आता है? दिस कम्स फ्रॉम द बोन, फ्रॉम द लेवल ऑफ द इम्प्लांट टिल विच पॉइंट? टिल द सॉफ्ट टिश्यू, राइट? सो द कंप्लीट टिश्यू पार्ट, whether it is bone, if it is subcranial implant and the soft tissue, both are covered by this part, the C part, right? So when you say the gingival height is 1 mm, 2 mm of the abutment, 3 mm of the abutment, what is changing is this C. This, the chrome part is fixed, सबके लिए fixed है, सारे इम्प्लांट के लिए फिक्स, उस पर्टिकुलर कंपनी के इम्प्लांट के लिए फिक्स है. उसको लेंथ और डायमीटर ऑफ द अबटमेंट से फर्क नहीं पड़ता. जो gingival height, have you know how to select an abutment? You select an abutment by three ways. One is the angulation, straight or angled. The second is the diameter, and the third is the gingival height, GH. Have you heard of this word or not? No. So this GH or the gingival height should be the same as the height of your हीलिंग अबटमेंट. ध्यान है, हीलिंग अबटमेंट दो पैरामीटर्स थे, डायमीटर और हाइट. तो ये हाइट सेम होनी चाहिए जो आपके हीलिंग अबटमेंट की थी, राइट? तो हर कंपनी में अगर 1 mm का हीलिंग अबटमेंट आता है तो 1 mm का GH का अबटमेंट भी आता है, ताकि दोनों कोइंसाइड हो सके. ठीक है. अगर आप ये करोगे तो द प्लेटफॉर्म विल बी एग्जैक्टली एट द पॉइंट दैट यू वांट इट टू बी. ओके. Now the third part is this part, which is the L and the D, right? This is what your prosthetic connecting part. यहाँ पे आपके आके आपका क्राउन क्या होगा? सीमेंट होगा, right? Now this B diameter has got nothing to do with the diameter here, bottom वाले diameter से कोई फर्क नहीं है इसको. This is the top diameter, right? So this diameter is based on what kind of a space do you have. अगर mesodystally space आपकी 8 mm है तो you will use a larger diameter. अगर space कम है तो आप diameter कम काम में लोगे. So this is purely based on the prosthesis space. क्राउन के लिए कितनी स्पेस बाकी है, राइट? योर मीजोडिस्टल डिस्टेंस, योर बक्कोलिंगुअल विड्थ एंड योर ऑक्लूजल लेंथ, उसके हिसाब से ये डिटरमाइन होगा, राइट? सो मोस्ट ऑफ द कंपनीज विल ओनली हैव 2 Ds, 4.5 एंड 5.5. ठीक है, कंपनीज वांट टू रिड्यूस देयर एसक्यूज, कितनी इन्वेंट्री रखेंगे, कितना रिड्यूस करेंगे आपको, तो 4.5 इज यूज्ड फॉर प्रीमोलर्स एंड 5.5 इज यूज्ड फॉर मोलर्स, सिंपल. क्योंकि इन जनरली मोलर्स के लिए ज्यादा स्पेस चाहिए और प्रीमोलर्स के लिए कम स्पेस चाहिए. ये जो एल है ये कितना होना चाहिए, मिनिमम एल कितना होना चाहिए, 4 mm. क्योंकि किसी भी चीज को सीमेंट करने के लिए आपको एटलीस्ट 4 mm लेंथ चाहिए अबटमेंट की. जब क्राउन प्रेप भी करते हो तो भी क्राउन की लेंथ कितनी होनी चाहिए आफ्टर प्रेप, मिनिमम 4 mm. तो ये कितना होगा, 4 mm होगा. तो ये भी कंपनीज अलग अलग बनाती हैं, they make it right up to 7 mm also. So if you want you can cut it. So this part you can mill it, you can customize it, right? But the other 2 parts you do not touch them with your burr. You do not touch this part or this part with your burr. You only modify this part. So whenever now you select an abutment, you just don't tell them give me a straight abutment. You also tell them what gingival height should be there on the abutment. You also tell them what should be the diameter of the abutment and what should be the length of the prosthetic part. Right? So this is the parameters for what? A straight abutment. The straight abutment is used where? Now can I use this abutment for a screw retained case? No. I can use this abutment only for a cement retained case. Simple. Clear? And normally used in mandibular, premolars and molars. क्योंकि angulations नहीं होते वहाँ पे. Maxillary bone में angulation फिर भी कभी-कभी हो जाता है. So ideally used for posterior cases, premolars and molars, right? Now GMI makes 2 of these abutments, the straight abutments. Again, ये वाला क्या indicate कर रहा है? RP, और ये वाला क्या indicate कर रहा है? WP. So GMI में जो implant connection segment है, वो भी 2 तरह के हैं. नॉर्मली एक कंपनी में एक तरह का होता है, बट GMI में वो भी 2 तरह के हैं. क्या क्या है? RP और WP. नोबल में 3 तरह के हैं, ठीक है? एंड कोवल मेडी में एक ही है, एक्सेप्ट फॉर अ नैरो डायमीटर which is 3.1 and less, right? So this is what is there. So as the indication is there, it is used for single or multiple cement retained restorations. और ये तभी काम में होगा जब आपके implants parallel है. Obviously तभी सीट कर पाओगे, right? Now we come to something known as a angled abutment, right? Now again 3 parts है angled abutment के भी. इसका और straight abutment का क्या part same होगा? अगर ये सेम कंपनी का इम्प्लांट है तो द इम्प्लांट कनेक्शन सेगमेंट सेम ही होगा ना, राइट? सी अगेन जिंजाइवल हाइट के हिसाब से वेरी करेगा, और जो एंगुलेशन है ए वो 15 to 25 डिग्री तक आता है. कई कंपनीज नाउडेज मेक इट टिल 45 डिग्रीज ऑल्सो. सो अगर आपको एंगल चेंज करना है क्योंकि आपका क्राउन डिफरेंट एंगल पर आएगा, राइट? तो आप क्या करोगे, आप एंगल अबटमेंट काम में लोगे. एंगल अबटमेंट मोस्ट कॉमनली कहां पे काम में लोगे? मैक्सिलरी एंटीरियर्स, बिकॉज ऑलवेज देयर विल बी एंगुलेशन, राइट? सो इट इज मोस्ट कॉमनली यूज्ड इन मैक्सिलरी एंटीरियर एरिया. सो दिस इज द एंगल्ड इम्प्लांट अबटमेंट. सो एंगल में बेसिकली क्या चेंज हो रहा है? द प्रोस्थेटिक कनेक्शन सेगमेंट इज गेटिंग चेंज्ड. अच्छा, एक और चीज पेक्यूलियर होती है एंगल्ड अबटमेंट्स में. इन जनरल एंगल्ड अबटमेंट में जो प्रोस्थेटिक कनेक्शन सेगमेंट होता है ना, वो कंपनी ज्यादा लंबा बना के देती है. द लेंथ इज ऑलवेज मोर एंड द डायमीटर इज ऑलवेज लेस. यहां पे आपको डायमीटर का ऑप्शन ही नहीं दिया. देयर नो 2 डायमीटर्स अवेलेबल बिकॉज यू वांटेड नैरो ओनली बिकॉज एंटीरियर एरिया. सो कंपनी डज नॉट गिव यू एनी ऑप्शंस ऑफ डायमीटर. हियर द ओनली ऑप्शन इज ऑफ अ लेंथ, एंड नॉर्मली द लेंथ इज लॉन्गर बिकॉज छोटी लेंथ को बढ़ा नहीं सकते आप. बट बड़ी को कम तो कर सकते हो. So company makes use of a longer length because your anterior tooth might be of different lengths available depending on your bone level, right? So this is a angulated abutment. Again, GMI makes it for 15 and 20 degrees, right? And this is what is there for the mapping of it. Again, used for single or multiple use, cement detained restorations, right? Clear? Now, this is known as a millable abutments. सर कितने abutment रखेंगे, कितनी gingival height रखेंगे, कितने diameter रखेंगे, कितनी health रखेंगे, पॉसिबल नहीं है. तो कंपनी एक बड़ा सा आपको abutment दे देती है जिसके ऊपर कोई प्लेटफॉर्म नहीं बना हुआ, कुछ नहीं बना हुआ, सिर्फ इम्प्लांट कनेक्शन सेगमेंट बना हुआ है. आप बाकी सब कुछ खुद बनाते हो, खुद मेल करते हो. यू कस्टमाइज इट. You can customize the gingival height. You can customize the total height also. So this is known as a millable abutment. But the only problem is this has to go to the lab, and the lab will mill it according to whatever they want to. But remember, इसमें भी जो नीचे वाला पार्ट है वो कंपनी फिटेड है. लैब नीचे वाले पार्ट को टच नहीं करेगी. इम्प्लांट कनेक्शन सेगमेंट will not be touched by the lab. They will only be determining the gingival height and the prosthetic connection segment का diameter और contour, right? कभी अगर आपने posterior में भी implant गलत angulation पे डाला हो तो, मतलब different angulation पे डाला हो तो, I will not say गलत angulation पे, different. See, the purpose of all these abutment angulation is कि जो prosthetic path of insertion है वो common हो सकता है आपके इम्प्लांट पैरेलल नहीं हो, बट आपके अबटमेंट के प्लेसमेंट के बाद में अगर आपको सीमेंट डिटेन प्रोसेस लगाना है तो पैरेलल होगा तभी जाएगा ना. अगर अंडरकट होगा तो जाएगा ही नहीं. सो द पर्पस ऑफ यूजिंग एन एंगल्ड अबटमेंट और कस्टमाइजिंग द प्रोस्थेटिक कनेक्शन सेगमेंट इज सो दैट इन केस ऑफ मल्टीपल इम्प्लांट यू कैन हैव अ पैरेलल पाथ ऑफ प्लेसमेंट. द पाथ ऑफ प्लेसमेंट ऑफ द प्रोसेसेस शुड ऑलवेज बी पैरेलल. यस, नहीं काम में लेता है. इम्प्लांट इज रिजिडिटी, खत्म, सिंपल. एवरीथिंग हैज टू बी रिजिड इन इम्प्लांट्स. नो कंसेप्ट ऑफ नॉन रिजिडिटी. मतलब आई डोंट पर्सनली बिलीव इट. देयर इज नो कंसेप्ट ऑफ नॉन रिजिडिटी. एवरीथिंग हैज टू बी रिजिड 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 रिजिड. ठीक है, वी आर रिजिड पीपल, वी विल रिमेन रिजिड एंड एवरीथिंग हैज टू बी रिजिड. सिंपल. सो नो प्लाईवे एनीवे, नो नॉन रिजिड कंपोनेंट्स.
How to decide which angulated abutment to use? Which angulation?
वो तो you will have to imagine it. मतलब to place, try to place 15 degree. लग रहा है नहीं ज़्यादा angulated है, so you place 0 degree. लग रहा है कम angulated है, you place 25 degree. You just have to use your angulations and your brains to do it. Okay, मतलब उसका कोई set formula नहीं है कि anterior में इतना ही होगा, posterior में इतना ही होगा. In case you don't want to open up multiple abutments, what you can do is you have an abutment selection kit also, जिसमें abutments of different diameters and different lengths and different angulations are available like plastic abutments, like plastic pegs. आप उसमें डालो, देखो कौन सा काम आएगा, फिर वही open up करो, so that you don't have to open up multiple ones. Okay? Ideally, that is the way. In the patient's mouth, it's very difficult to decide. But with experience, you can decide in the patient's mouth also. Because remember, मुझे जो gingival height determine करनी है, वो तो मैंने पहले प्रोब से कर सकता हूँ. पेशेंट के माउथ में तो मेरी GH आ गई. इम्प्लांट कनेक्शन सेगमेंट तो ऑब्वियसली कंपनी वाला ही है. सिर्फ मेरा प्रोस्थेटिक कनेक्शन सेगमेंट बच गया. So if I can see in the patient mouth how much is the interocclusal space, I can measure that. I can measure the mesodistal space. Angulation, I can keep my instrument at different angulation and decide it in that way also. Remember, जो आपका driver होता है ना, implant driver that comes out when you place your implant, that is your implant angulation. So if I use a straight abutment, I might be at this angulation. So then I can decide how much angulation do I have to change. Right? So these things will become better with experience. हो सकता है initially you might open up an abutment which is not the right abutment, but again you can keep it back and then reuse it. Okay. Now In case I want to give a temporary immediately, I have an abutment known as a temporary abutment. ये abutment कैसे different है बाकी उससे? एक तो इसमें सारा कुछ ऐसे मटेरियल से बना है which is teak. Everything is flexible here. यहाँ पे rigidity नहीं है, क्योंकि मैं immediate loading कर रहा हूँ. मुझे पहले 3 महीने rigidity नहीं चाहिए इनके बीच में. Secondly, teak is white in color. Whatever process I will be building up my process with composite in the patient's mouth only. So मैं नीचे metallic color नहीं चाहता, because metal color फिर reflect होगा, so it will not look good. Then titanium से bond नहीं होगा, composite. इस material से composite easily bond होगा. So this is used for giving a chair side temporary, right? Plus this material has got another advantage. Now I have done immediate loading or immediate non-functional loading. Non-functional loading means I have placed the crown, but if the patient closes or bites in maxillofacial, this is not in occlusion, this is out of occlusion. So we call it non-functional loading, right? पेरिओरल फोर्सेस लगेंगी, टंग की लगेंगी, चीक की लगेंगी, थोड़ी बहुत स्विंग फोर्सेस लगेंगी, बट बाकी से कम लगेंगी. अगेन जैसे मैंने क्या बोला था, इन केस यू वांट टू प्रिजर्व समथिंग जैसे मैम ने कहा था, either with a cushion in it or something which is weaker. Now here, in case the patient accidentally bites on this, now PEEK is not as rigid as a titanium. So what will happen? It will compress. So it will absorb some forces before transferring it to the implant, and from the implant it will get transferred to the bone, right? So forces are reduced, and because of that reduction in the forces, the chances of failure of osseointegration are reduced. So this PEEK gives you multiple advantages, but again, can I use this for a final restoration? No. So again, after 3 months I have to change it. Getting the point? Again, after 3 months I will have to change it. Okay, now एक और टॉपिक ऑफ डिस्कशन आता है, वो आता है ना, अभी तक अपन ने what all abutment that we saw right now were all used for cement retained crowns, right? They were all used for cement retained crowns. Now, in case you want to use a screw retained crown, what are the options that you have? प्लास्टिक यूज में ले लो. क्या करें प्लास्टिक का फिर? You use an abutment like this. What is this abutment known as? Meta G UCLA abutment. This is not a UCLA abutment. This is a Meta G UCLA abutment. क्या दिख रहा है इसमें? नीचे क्रोम का पार्ट दिख रहा है. This part is what part? Implant connection segment. ये कहां से बनकर आया है? कंपनी से बनकर आया है. उसके ऊपर रेड पार्ट दिख रहा है, वो एक प्लास्टिक स्लीव है जिसके ऊपर मैं वैक्स पैटर्न बना सकता हूं, जिसको मैं कस्टमाइज कर सकता हूं, राइट? सो व्हाट आई डू इज आई यूज दिस abutment. I will customize my part of the transgingival segment and the prosthetic connection segment. I will make my crown framework also on top of it and do the casting. So when I do that casting, what happens? I get an abutment on which the ceramic layering can happen directly. Prosto मालूम है कैसे बनता है crown? मालूम है non prosto people को. How is the crown made? You first make a metal framework. How do you make a metal framework? You make a wax pattern. You do casting of that wax pattern. Now I will not cast this in this shape only. I will cast it in a shape where my crown is also shaped with this. So my implant is separate, my abutment and my prosthesis becomes one. It is one single unit. So अगर ये एंटीरियर होगा तो मैं इसको क्राउन कटिंग वाले एंटीरियर की शेप में फॉर्म करूंगा और उसकी कास्टिंग वैसे ही करूंगा. अगर पोस्टीरियर होगा मोलर तो मैं इसको उसी शेप में बना के वैक्स से कास्टिंग करूंगा. सो वंस माय अबटमेंट इज रेडी, दिस थिंग इज रेडी आफ्टर कास्टिंग, कैसा दिखेगा? नीचे से तो ऐसे दिखेगा, बट ऊपर से कैसा दिखेगा? जो भी टूथ का शेप मुझे देना होगा वो वैसा ही दिखेगा. उसके ऊपर फिर क्या करेंगे अपन लोग? सिर्फ सिरामिक की लेयरिंग कर देंगे. सो व्हाट हैव वी डन इज वी हैव बीन एबल टू जॉइन द अबटमेंट एंड द क्राउन. उनको अलग से जोड़ने के लिए सीमेंट की जरूरत नहीं पड़ी. आर यू फॉलोइंग मी हियर? नहीं. सी इमेजिन देयर इज एन अबटमेंट, नॉर्मल सीमेंटेबल अबटमेंट है. उसको मैंने क्या करा? मुझे उसके ऊपर क्राउन बनाना है. व्हाट डू? आई टेक द सीमेंट अबटमेंट, आई मेक अ वैक्स पैटर्न ऑन टॉप ऑफ इट एंड देन आई डू द कास्टिंग. मेरी मेटल की कास्टिंग आ गई. उसके ऊपर मैं क्या करूंगा? सिरामिक की लेयर कर दूंगा. अब मैं ये चाहता हूं कि ये जो मेटल की कास्टिंग आई है ये अबटमेंट से कैसे जुड़ रही है? सीमेंट से. बट मैं चाहता हूं कि सीमेंट से नहीं जुड़े, ये दोनों एक ही हो जाए. बट वहां पे तो क्या था? माय अबटमेंट वाज मेड बाय द कंपनी, वो तो पहले से बनकर आया था और ये मैंने यहां पे बनाया था. तो हाउ डू आई जॉइन देम? आई हैव टू यूज एन एडिसिव. सो व्हाट डू? आई डू समथिंग व्हिच इज इन बिटवीन. I make the transgingival part of the abutment and the prosthetic part of the abutment also myself. So जब मैं वो बनाता हूं तो मैं उसको ऑलरेडी वो शेप दे देता हूं क्योंकि क्राउन का शेप होगा. जब मैं वैक्स पैटर्न बना रहा हूं, उसकी कास्टिंग कर रहा हूं, तो आई विल कास्ट थ्री थिंग्स. आई विल कास्ट द transgingival part of the abutment, I will cast the prosthetic part of the abutment, plus I will cast the framework of the prosthesis also together. ये अच्छा. Now this implant connecting segment से वो कैसे जुड़ता है? इंटरलॉकिंग से. When the lab does the casting, they will create interlocks. ठीक है? तो जो इंटरलॉकिंग होती है उससे वो ज्वाइन हो जाता है. Then when you finally tighten it with a screw, they are joined together. So that is why the company gives you this sleeve to work upon. ऐसा नहीं कि फ्रीली वर्क कर सकते हो आप इस स्लीव को ही शेप दोगे. आप इस स्लीव के अराउंड ही वैक्स पैटर्न को बिल्ड करोगे. ठीक है? सो जो फाइनल अबटमेंट बनकर आएगा, अगर आप उसको, आप लोगों ने कल मुझे एक सीमेंट टिन क्राउन, स्क्रू टिन क्राउन दिखाया था वहां पे, राइट? तो वो वैसे ही शेप का बनकर आएगा. ओनली थिंग इज सिरामिक की लेयरिंग उसके ऊपर बाद में. सो इन अ स्क्रू रिटेन्ड क्राउन, राइट, you are making the abutment, you are making the crown. Both the things you are making it. But because I don't want to make everything, I use this kind of an abutment जिसमें एक पार्ट जो कि सबसे क्रिटिकल पार्ट है, जो कि मेरी फिट को डिटरमाइन करता है, वो कौन बना रहा है? वो कंपनी बना रही है. बाकी सारा पार्ट मैं खुद बना रहा हूं. मैं चाहूं तो ये पार्ट भी खुद बना सकता हूं. That is when you have a complete plastic cylinder known as a plastic UCL. But the drawback in that is what? जो इंटरनल पार्ट है उसकी भी कास्टिंग मैं कर रहा हूं. हो सकता है कास्टिंग एक्यूरेट हो, फ्रॉस्ट वाले बताएंगे कास्टिंग कभी एक्यूरेट नहीं होती, तो वो बैठ तो जाएगा बट वो प्रॉपर्ली अडेप्ट नहीं होगा. ये सीट भी हो जाएगा बट दे विल नॉट बी अडेप्टेड. ऐसे में सीट होगा, वॉल्स में गैप रहेगा, डिस्टेंस रहेगा, राइट? लेकिन उसमें एक फायदा रहेगा. जैसे इसने पूछा था, he asked in the same way is कि I won't have to join that with this part. कोई मैकेनिकल इंटरलॉक नहीं क्रिएट करने पड़ेंगे क्योंकि सारा ही एक सिंगल यूनिट है. सो अच्छा, there is another drawback that is there, a major drawback. What material is used for casting? What metal is used for casting? Nickel, cobalt and chromium. Or if you want to use a nickel-free alloy, then it is cobalt and chromium. So if you are casting the complete thing, even the implant connection segment is what? If you are casting the complete thing, cobalt chromium. So in my titanium implant, what is fitting in? Cobalt chromium. Do I want two different materials? No. Because cobalt chromium is more stronger than titanium. So there are chances that the wall of the implant might fracture. Right? So that is a drawback of a plastic UCL. So no doctor, no experienced clinician will use a plastic UCL. Right? They will all use this kind of a UCL. Okay. Now, in this part also, see, data hai, I know it is too much of a data to process, but we have limited time to give you. I don't want to confuse you, but I want you to remember some parts of it. Now, this part also, some companies have started making in cobalt chromium. लेकिन नीचे वाला टाइटेनियम में बना होना चाहिए था. Some companies itself have started making into cobalt chromium. Why? Because वो जो कास्टिंग होके मैकेनिकल इंटरलॉकिंग होती थी ना, वो टाइटेनियम के साथ में बहुत मुश्किल होती थी कोबाल्ट क्रोमियम की. तो उन्होंने बोला कि लेट्स मेक ऑल इन कोबाल्ट क्रोमियम. बट द आइडियल वे इज टाइटेनियम, and then the top part let it be whatever you want to. So the implant has to be titanium. The implant connection part should be titanium. The transgingival part and the prosthetic part can be any material. It can be a gold based alloy, it can be a base metal alloy, it can be titanium also. Nowadays certain labs are printing abutments. They call them smart abutments. Okay? They say, okay, we don't want anything. We will make the abutment for you. We will mill it and make it. Definitely they are also milling it, but imagine a company which is using a 100 CR machine to make it and a company which is using a 1 CR machine to make it. Definitely the quality will be different. But sometimes you have to do it. Now I'll tell you an example, we were using an implant company which was based out of Germany before COVID. Okay. So it was a wonderful implant company and every implant, the USP was every implant in the packet there was a pen drive. Every packet you open there is a pen drive. Okay, the pen drive is shaped like a visiting card. It's just like a visiting card and a small pen drive in that. Okay. Good. It's a German company, we're using it. We use lots of it. Then, okay, not COVID. Then this thing happened. 2016 is when notebandi happened. So 2016 happened. Okay. The company unfortunately was trying to do something which was not very legal. So they were caught. The company had to close its operations in India and the company went off. Now I have got patients, I have placed implants in the patients. I don't have the required abutments. What do I do? Right? Because the connection was not similar to any other implant company. So I decided to call up the company in Germany. They're still operating outside India. I called their offices in Germany. So one abutment which used to cost me 4,000 rupees started costing me around 26,000 rupees. Because I had to bear the import cost, the taxation, and the pricing they were giving me was the European pricing. I have already placed implants, I have already quoted the patient. I cannot afford 24,000 rupees abutment for all my cases. So in those cases I have to use a printed abutment by the labs. Right? Or if I have to customize my abutment in such a way that the company doesn't make that kind of abutment, then I can use a smart abutment. Okay? Or in case I don't have the inventory in place, I want it faster, better. Right? Then I can use a smart abutment. So that is the time when I learned two lessons. First is I always buy my abutments alongside with my implants now. No separate buying. Give me implant plus abutment. Secondly, I prefer to use a company where there is an option of in case that company closes down, then I should have an option to move to a different company. It might not be 100% fit, but it should be at least be a 98% or 99% fit. There should always and always be an option. Never get stuck with a company which is the only person. Okay? Because the after sales services might differ. So this is important. So now we have in the cemented abutment segments, we have abutment for permanent processes and temporary processes. Permanent process we have got straight abutments, we have got billable abutments, and we have got angled abutments. For temporary processes we have got temporary abutment made up out of peak. For a screw retained crown we have got two abutments, plastic UCLA and a Meta G UCLA or a metal UCLA, right? A metal UCLA, the bottom part is made by the company. The top two parts I can customize it. In a plastic UCLA I can customize everything. Like everything is cast by me, right? So these are castable abutments and screw retained. Then we have a segment of printable abutments. I can print my abutments. Okay? In that I print all the three parts. I just take the CAD design from the company of the internal connection and my lab prints all the three parts. I can get the printing done in cobalt chromium. I can get the printing done in titanium. I'll just tell you a ballpark figure. A cobalt chromium printed abutment might cost me say 2500 rupees. Whereas a titanium printed abutment will cost me at least 7,500 rupees. This is a huge difference. Right? Costing wise. So remember that. Now coming to the abutments, we know now coming to the discussion which is there, which is this. Which is better? When to go ahead with what? Which is better? How many of you say cement retains are better? How many of you feel that cement retains are better? How many of you feel screw retains are better? Okay, raise your hands. और बाकी लोग डिसाइडेड ही नहीं है सर. हम तो ओरल सर्जन है सर, हमने तो प्लेस कर दिया सर, काम खत्म सर हमारा. ओरल सर्जन सीमेंट डिटेन. व्हाट अबाउट यू? कोई तो ओपिनियन होगा, कोई तो प्रेफरेंस होगा. सीमेंट डिटेन. You had your sleep also, Isha, now at least answer. Cement retain or screw retain? Screw retain. Okay, any one of you give me an advantage of a screw retain? Yes. Retrievability. I can retrieve it easily. I can just open it up, take the screw out and retrieve the processes whenever I mean to. Yes. Retrievability is an example, is an advantage for screw retain. So 1.2 screw retain. Then another advantage. वो तो आपके फॉल्ट है ना, आपने सीमेंट छोड़ी है इसलिए हो रहा है. चलो फिर भी we'll take it. कि reduce chances of peri-implantitis, but ideally you should be able to remove the cement, right? Why should you have cement remaining inside? Okay, then screw retain के फेवर में दो एडवांटेजेस हैं अभी तक के. क्या? Surface interface तो सेम है. इम्प्लांट कनेक्शन सेगमेंट तो सेम ही है ना, वही इंटरफेस है आपके. ऊपर वाले पार्ट से फर्क नहीं पड़ता. It doesn't make a difference that the process segment is 7 mm length or 10 mm length. No, it does not make a difference in the force distribution. Then दो एडवांटेजेस हैं स्क्रू रिटेन के. सीमेंट रिटेन का कोई एडवांटेज नहीं है. एस्थेटिक्स आर बेटर. यस. एंटीरियर टूथ में इमेजिन करो लेवल साइड से एक होल आ रहा है. इज इट राइट? इट विल लुक गुड? नहीं. तो फिर नहीं कर सकते. फिर नेक्स्ट, तो सीमेंट रिटेन का एक एडवांटेज हुआ कि इट इज मोर एस्थेटिक. किसमें होते हैं मोर चांसेस ऑफ स्क्रू लूज? स्क्रू रिटेन में होते हैं. क्यों? क्योंकि स्क्रू है. स्क्रू तो इसमें भी है. स्क्रू है तो इसमें भी ना. इसमें डिफरेंस ये है कि वो स्क्रू अबटमेंट को रिटेन कर रहा है, उसमें स्क्रू अबटमेंट और क्राउन, क्योंकि वो दोनों एक ही चीज है, वो उनको रिटेन कर रहा है। सो स्क्रू लूज में ज्यादा स्क्रू रिटेन में होती है, बट क्यों होती है? ये तो सही बोल रहे हो कि होती है, बट रीजन क्या है? मैंने अभी क्या बताया था? यस, मैंने क्या बोला था? वीकेस्ट पार्ट ब्रेक्स। सो इस असेंबली में मेरा पहला पॉइंट है इम्प्लांट टू अबटमेंट जंक्शन। सेकंड वो, और उसको कैसे रिटेन हो रहा है? स्क्रू से। सेकंड जंक्शन है अबटमेंट से लेकर क्राउन का, वो कैसे रिटेन हो रहा है? सीमेंट से। यहां पे मेरा एक ही जंक्शन है, तो मैंने क्या बोला था? कोई भी फोर्स पड़ती है तो कौन सा जंक्शन पहले टूटता है? वीकर। तो सीमेंट जंक्शन इज वीकर, तो सीमेंट के डिसलॉज होने के क्राउन ज्यादा चांसेस है रादर देन स्क्रू लूजनिंग, राइट? तो एक एडवांटेज हो गया सीमेंट रिटेन के लिए कि स्क्रू लूजनिंग के चांसेस कम है ना, ठीक है। और दूसरा एडवांटेज हो गया एस्थेटिक ज्यादा है। और कोई एडवांटेज? डिसएडवांटेज? एंगुलेशन क्या?
सीमेंट रिटेन में हम एंगल चेंज कर सकते हैं।
किस चीज का एंगल चेंज कर सकते हैं?
सर अगर इम्प्लांट एक सर्टेन एंगल पे प्लेस्ड है, एंटीरियर हम के लिए हमें उसका एंगल चेंज करना है तो हम एंगल अबटमेंट यूज कर सकते हैं सीमेंट रिटेन में। स्क्रू रिटेन में हमें इम्प्लांट के पैरेलली स्क्रू डालना पड़ेगा।
स्क्रू का एक्सेस होल कहां से आएगा वो डिटरमाइन नहीं कर सकते आप। एंगुलेशन तो आप इक्वली उसमें भी चेंज कर सकते हो, एंगुलेशन तो आप 50 डिग्री तक भी कर सकते हो, लेकिन जो एक्सेस होल आएगा जहां से आप डाल रहे हो वो फिर लेबियल साइड से आएगा, ये प्रॉब्लम होगी। सो एंटीरियर में इसलिए सीमेंट रिटेन करते हैं। और कोई डिसएडवांटेज? सोचो तो सही, स्क्रू सीमेंट बेसिक बात है। कौन सा बनाना इजी होगा? सीमेंट रिटेन बनाना इजी होगा, यस। आधे ज्यादा काम तो मैन्युफैक्चर ने करा ही हुआ है ना, तो वो होगा। देन ना इमेजिन मल्टीपल दांत है, 6 दांत है मेरे, अब मुझे उसमें सीमेंट रिटेन प्रोसेसेस बनाना भी है और लगाना भी है, तो मेरे हर एक अबटमेंट में कितनी पोजीशन में डाल सकता हूं? 6। So 6 implants in which 6 abutments can be placed in 6 different ways. Now मैंने प्रोसेसेस जिस एंगुलेशन पे बनाया है उसी एंगुलेशन में शिफ्ट होना चाहिए अबटमेंट, राइट? तभी मेरा प्रोसेस सीट होगा। विल इट बी वेरी इजी टू डू इट? क्योंकि अगर एक भी अबटमेंट मेरा डिफरेंट हेक्स पे हो गया, पोजीशन चेंज नहीं हो रही है, हेक्स चेंज हो रहा है, राइट? तो अगर मेरा एक भी अबटमेंट डिफरेंट हेक्स पे चेंज हो गया तो मेरा प्रोसेसेस सीट नहीं होगा। अच्छा, मुझे कितनी बार अबटमेंट पेशेंट के मुंह से लैब में ट्रांसफर करना पड़ेगा? पहले मेटल ट्रायल के लिए। नाउ इमेजिन वी आर मेकिंग अ फुल माउथ सीमेंट रिटेन केस। Patient comes to us with the healing cap. We put the healing cap. We make a open tray impression post. We do a verification jig, right? We do a pickup impression, and we have the final cast, right? And we have taken the bite also, right? Now what are we doing next is metal trial, right? So पहले अबटमेंट लगाएंगे हम लोग कास्ट पे, फिर उसके ऊपर क्या करेंगे? मतलब मेटल फ्रेमवर्क बनाएंगे। अब वो मेटल फ्रेमवर्क मुझे वेरीफाई करना है पेशेंट के माउथ में। तो मैं क्या करूंगा? मैं एक और जिग बनाऊंगा, पैटर्न जिग, ट्रांसफर जिग कहूंगा मैं उसको। उससे मैं क्या करूंगा? अबटमेंट सेम उसी पोजीशन में पेशेंट के मुंह में ट्रांसफर हो, फिर मैं उसको टाइट करूंगा, फिर मैं क्या करूंगा? उसके ऊपर मेटल ट्रायल लूंगा, फिर मैं उसको निकालूंगा, फिर मुझे सेम पोजीशन में कास्ट पे ट्रांसफर करने ताकि मैं आगे का काम कर सकूं, फिर मैं उसको कास्ट पे ट्रांसफर करूंगा, फिर मैं सिरामिक बिल्डअप करूंगा, फिर अगेन आई हैव टू रिपीट द सेम थिंग इन द पेशेंट्स माउथ फॉर अ सिरामिक ट्रायल एंड देन फाइनली फॉर अ फाइनल ट्रायल। इट इज डिफिकल्ट, इट इज टाइम कंज्यूमिंग, इट इज नॉट इजी, राइट? एक भी अपार्टमेंट इंटरचेंज हो गया या एक भी अपार्टमेंट की पोजीशन इंटरचेंज हो गई, देन आई एम गॉन, देन आई एम लॉस्ट, then I'm just doing a trial method कि maybe this is fitting in, right? स्क्रू में तो उसका ऑप्शन ही नहीं है, जहां से निकाला वहीं पर ही जाएगा and all that is joined together, right? So in cases of single tooth cases or simple bridges where the implants are more or less parallel, like the case we have yesterday, and the interocclusal height is adequate, I can go ahead and use a cement detained crowns. But for more complex cases, like a full mouth rehab, or when the angulation is too varied, and I've got multiple implants to work with, I will prefer what? But that does not mean that screw retained is better than cement retained. No, in no ways. Both have their indication. If it is a single central incisor, my best prosthesis is a cement retained prosthesis, full stop. No doubts about it. If you put a screw retained prosthesis with that lingual bulge where your screw is coming out, patient tongue will always and always go on that bulge only. Right? So, we'll take a break of 10 minutes, you can take your sleep. And I know the topic is very dry today, but these are important basics which you have to remember. We'll be back in 15 minutes, okay? And if you can get me some component, can we manage that today? Can you manage that projection here only? You go,